much for being here today, helping me with my interview. So, I'm a first year student, of course, doing nursing. You're a nurse yourself, which is very helpful for this. So, what we're studying at the moment is communication and why it's so important, obviously, in nursing. So, I'm just wondering from you what your thoughts are on communication, what's important things to remember.
In nursing or just in general?
In nursing.
Okay, so in nursing, probably communication is the integral part of what we do. So in communication between, nurses and the patients, or nurses and doctors, or other allied health. It's what we centre all our work around.
Yeah, of course. So with patients, obviously, you have handover and all that sort of stuff. Have you ever had any bad experiences or anything, it's going to affect the patient, if you don't write something down
absolutely.
properly,
if you don't communicate something properly, or if there's ineffective communication in a handover, then the person receiving the handover may not understand or may be confused and then go off and might miss really important parts that you need to do with regards to a patient.
So in regards to as well therapeutic relationships and kind of non-verbal stuff, what's really important kind of trying to build, I guess, rapport? And
in non-verbal communication.
Yeah.
So obviously level body rather than looking down on people.
Yeah, because if you're looking down, they kind of feel like they're, you've got the power over them, and obviously that's just
what else? Probably looking people in the eyes, using hand gestures as well.
Yeah.
That's another big thing. Maybe touching someone.
Definitely. Make them feel comfortable with you and all that sort of stuff.
Smiling. Those sorts of and those universal.
Speaking of universal sort of things, have you ever had a patient that English is kind of like their second language, and how do you go about dealing with that sort of stuff?
All those things I talked about. Also, there's in the hospitals they'll have words in dual languages, so maybe Farsi and English, and so they can point to something that might be they're in pain, and then it's obviously written in English, so we can understand, we can communicate that way. Another way might be pen and paper, or a whiteboard and a pen for people. They might have interpreters, they might have family members.
What about in cases of emergency situations? Do you kind of just have to?
Well, in an emergency situation, it's hard to explain. Probably they don't need to talk if it's an emergency.
But you just kind of
that's more from non-verbal assessment of patients. So you're assessing them by their vital signs if there's an emergency. Often, not always, but often a patient won't tell you because they aren't critically unwell. So you do what you need to do. But then there's all those legal things that come into it beforehand. So, when they get admitted, they'll have next of kin, all that sort of stuff.
Yeah, definitely. Also, just wondering about when you have kind of patients that are agitated and difficult, what's different? Obviously, you've got therapeutic relationships, but then if someone's, has violent behaviours or is just really easily stressed out, agitated, how do you go about communicating?
It's all about reassurance as well. We're not, we don't judge people. They're patients. We're there to look after them. And often manipulative behaviour or poor behaviour could be, if we can control the issue, like pain or things like that, and through reassurance, often we'll get
as well as results. Educating them and just
listening to them. Some people might need to be on behaviour management plans as well with staff, but knowing boundaries as well, and respect.
Not pushing.
You respect me, I respect you. That sort of.
Yeah, definitely. What would you do in a case like that if someone was to start getting really, really violent?
Call security.
Yeah, and just kind of.
Not going to deal with
obviously,
it.
you can't do too
Call
much.
security, but it is also about listening, trying to listen. If there's people that aren't willing to listen and they're just violent, then
there's a difference.
You cut it off, stand back and look after yourself.
Yeah.
Call security and they can deal with it.
really
Yeah.
like, you have to really listen to a patient and hear their concerns so then you can do it.
Patients have a right to refuse now too.
Yeah.
So can't make them do anything.
Yeah,
Can only
definitely.
encourage them, give them the best, information,
Yeah.
and they work from that.
Yeah, give them advice to. Would you do that in nursing? Like give a lot of advice to people?
Not personal relationship
Yeah,
advice,
no.
but advice about their care. Like if they're refusing something as simple as pain relief,
Yeah.
but they might be visibly in pain, you might educate them about the fact that they're not going to get addicted and it will help. It will shorten their length of stay if they're pain free. They'll heal better. They'll,
Yeah,
those
definitely.
sorts of things.